Chlamydia trachomatis is the most common bacterial STI worldwide.
It's very easy to catch and very easy to pass on.
Chlamydia is a bacterial infection that's transmitted through body fluids. It infects the genitals and it can also infect the eye and the rectum. It also has a really good way of hiding inside the cells from the body's immune system.
The vast majority of people with chlamydia have no symptoms. That's more than 70%. Those that have symptoms, it depends where the infection is.
Chlamydia has some important long-term health consequences. Up to 40% of people with chlamydia can develop pelvic inflammatory disease, and that's a leading cause of infertility. Pelvic inflammatory disease can also predispose to endometriosis and chronic pelvic pain. And anyone who's infected with chlamydia has an increased risk of HIV transmission.
It can cause a number of clinical conditions, including trachoma, urogenital infection, and neonatal pneumonia and conjunctivitis. And finally, it causes a condition called lymphogranuloma venereum. Dysuria is common with pain when passing urine. Penile or vaginal discharge. Abnormal vaginal bleeding can present as either postcoital bleeding or intermenstrual bleeding. They may also have pelvic pain or testicular pain. And finally, if there's anorectal infection, they might have anal pain or discharge. But again, in this area, it's often asymptomatic. If the infection is in the cervix, it can ascend to cause upper genital tract infection. This in turn can cause pelvic inflammatory disease or PID. PID can cause chronic pelvic pain, and if it affects the fallopian tubes, it can cause tubal factor infertility.
Anyone who's sexually active should be tested for chlamydia, but particularly people 30 and under should be tested at least annually.
If someone's had a new partner in the last 12 months, has had an STI in the last 12 months, or who has a partner who has an STI, should also be offered annual testing. In addition, some people are at increased risk of complications, such as if they're having a termination of pregnancy or an IUD inserted. Other groups that might need testing include men who have sex with men. They may need testing up to 4 times per year.
Opportunistic screening refers to offering someone a test when they've come in for a different reason. So for example, if they've come in for a contraceptive consult, asking them whether they think they need to have an STI test and explaining why that you're asking.
Because most people with chlamydia have no symptoms, it's important to take every opportunity when you see a young person to offer them testing, even if they come to you for other reasons.
Clients will come in for different things, and you can just drop it into the conversation around preventative health as one of the things to add whilst they're there for their travel vaccinations or cervical screening testing, that sort of thing.
It's really important to normalise talking about sex. You can bring it up as part of a routine consultation. You can introduce it when discussing contraception or cervical screening. You can mention chlamydia when someone has come in for a sore knee. Just say, people under 30 have a high chance of chlamydia. Should we test you today?
If they're symptomatic, you definitely want to offer them examination in case you need to take additional tests or offer them treatment on the day. If they have no symptoms, it's important to find out which parts of their body may have been exposed to chlamydia, so you need to take a sexual history. For people who've had penile intercourse, the best sample is a first pass urine. This doesn't need to be done first thing in the morning. It can be done any time of day as long as it's been 20 minutes since they've last urinated. Usually you want to collect the first third of the urine, which has the most epithelial cells. For someone who's had vaginal intercourse, they can do their own self-collected vaginal swab. Finally, if someone's had anorectal intercourse, they need to do a self-collected anal swab. It's important to bring up anal sex because it's common not just amongst men who have sex with men, but also women. Anal infections are very common. There are some special groups, such as men who have sex with men, where you might want to offer something called 3-site testing because an infection can be present in one part of the body and not others. So in this case, you offer pharyngeal swabbing, a urine sample, and then self-collected anal rectal swabbing.
It's important to talk about how the person will receive their results, whether you're going to contact them or whether they need to contact you. You need to talk about what to do with a positive result and reassure them that they can come back for a simple antibiotic treatment.
Look, it's really important to let them know what causes chlamydia, how it's passed on, and how they can prevent themselves from having the infection again. It's important to advise them to abstain from sex for at least 7 days after they and their partner have had treatment.
Not everyone needs a test of cure. Pregnant women do, and people with rectal chlamydia need a test of cure. Otherwise, we recommend that everyone has a test of reinfection in about 3 months, and offering bloodborne virus screening at that time as well.
Reinfection rates are very common, and it's really important to make sure they haven't been reinfected, as the chance of pelvic inflammatory disease and other complications is much greater with reinfection.
As clinicians, we're responsible for notification. Chlamydia is a notifiable infection in Australia, and each state and territory has a infectious diseases branch. You need to assist the client in notifying their partner, so they may be able to notify their partner directly, or they may wish for you to do it. There are various websites where either clinicians or clients can anonymously notify any recent sexual contacts, and you can assist them with that. If you're unsure how to treat chlamydia, there are national guidelines which are available online and should be checked because treatment can change.
Chlamydia is easy to test and easy to treat.
So don't be afraid to start the conversation now.